welcome back to another one of our Why Wednesdays here at Mercy Grace Medical Aesthetics. Today we're talking about TCA in skincare. So TCA is commonly found in chemical peels. So most chemical peels do contain some sort of TCA, and it can be available in any concentration from 5% all the way up to 70%, and this is going to determine the depth of the chemical peel that you're receiving. So there's superficial chemical peels, medium depth chemical peels, and deep chemical peels. If the TCA concentration is above 50%, it's going to be a deep chemical peel, and this is going to be performed by a doctor in a surgical setting. It's going to be painful, and there's going to be lots of downtime and preparation work for this chemical peel if you're doing a deep chemical peel. Most chemical peels, however, are superficial or medium depth chemical peels, and that's what you're going to be finding in your med spa settings, or here, for example, we do medium depth chemical peels. So with medium depth chemical peels, there's actually not as much downtime. There's not really a whole lot of downtime at all. Usually for the first couple days, your skin will feel tight, a little red and irritated. Most people around that 48 to 72 hour mark might have some light flaking and peeling, and then that subsides anywhere from 5 to 10 days after the chemical peel. And then we also have PRX, which you've heard us talk about here. PRX is a topical solution that's massaged into the skin. This actually contains 33% TCA, but it's kind of unique in the fact that it's actually not a chemical peel at all, because with the other added ingredients, it can bypass that top layer of skin, go right to the dermis without the typical side effects you get from using such a high concentration of TCA. So you don't get really the peeling and the irritation and downtime like you would normally if you used a 33% concentration of TCA. So PRX is that's why they call it the unicorn treatment. It's in a category of its own and doesn't typically work as like most things with TCA do. So that's its own unique thing that you've heard me talk about before, but I'll definitely link the full blog post on PRX below, so that way you could check that out as well. But we're going to talk about TCA more so with chemical peels. So we have two chemical peels here that we have that use TCA. Actually, the Sensi peel. This is my favorite chemical peel to do for people who've never had a chemical peel before, to kind of introduce them to it, and those with sensitive skin. It has a concentration of 6% TCA along with some other fine ingredients in there. And then we also have the Ultra peel. So this is a peel that I use on people who've had a chemical peel before, did really well, and this has a 10% concentration of TCA. That's going to be really great for targeting hyperpigmentation and melasma. I've had really good results using the TCA peels in those who are struggling with hyperpigmentation and melasma. It really helps lighten that pigmentation and just overall smooth and brighten the skin. So how it works is TCA helps break down keratin, which is a protein that is naturally found in your skin. So superficial and medium depth chemical peels are going to help break down this keratin at the epidermal layer of the skin, which is the top layer of the skin, and the very top of the dermis, which is your deeper skin. And by doing this, it's going to actually help break down the keratin, and so it's going to help reduce the hyperpigmentation, reduce the acne, reduce fine lines and wrinkles, and also just help improve skin elasticity and hydration as well, which is always an added benefit. So things like hyperpigmentation can be really stubborn to treat, but TCA is a very effective treatment for helping reduce that pigmentation. So you can do chemical peels one of two ways. You can either get a singular chemical peel to help just kind of refresh the skin, brighten, smooth. You'll see results after just one chemical peel, but if you need a more dramatic transformation, or you have a lot more pigment or acne to be treating, you're going to want to do a series of chemical peels spaced 4 to 6 weeks apart, and determining on how much you need to reduce that pigmentation or acne will determine how many chemical peels you have to do. So like I said, peeling and flaking usually starts 48 to 72 hours after, and it can last anywhere from 5 to 10 days. Usually the first couple days your skin kind of can feel tight and irritated, almost like a sunburn would be the best way to describe the after feeling. Some people can tolerate it really well and they don't have that feeling at all. Other people are more sensitive and have that sunburn feeling. Some people don't even peel at all after a chemical peel, and that doesn't mean the chemical peel didn't work. Peeling does not equal results. The peeling that you're seeing with the chemical peel is dead skin being exfoliated off, but the TCA is still going to the pigment, lightening the acne, lightening the fine lines and wrinkles. So just because you didn't peel doesn't mean it didn't do all of that. That just means you had dead skin to be exfoliated. I really love dermaplaning with chemical peels because not only does it reduce your downtime because you don't have the peeling and flaking. No one really loves having flaky skin. It's not that fun. But it is a minor compromise to have clearer and better skin. But if you do dermaplaning before, I've found that people have less peeling and flaking because we're exfoliating that dead skin off, so then there's really no peeling and flaking that still needs to be done. And not only that, it'll actually help the chemical peel penetrate a little bit deeper because we're removing the dead skin that's kind of standing in the way of the chemical peel. So it'll help penetrate deeper, and then not only that, but the corrective products that we put on after can penetrate a little bit deeper. And then with all our chemical peels here, you get a little PCA post kit to take home with moisturizer, face wash, sunscreen, and a clinicone balm, which helps with any irritation that you may experience after the chemical peel. So that's really nice too to use for the week after. But chemical peels are definitely one of my favorite things to do. They're my favorite things to see because you can have such a good result after just one or even multiple chemical peels, especially lightening that hyperpigmentation. That's my favorite before and after to see, is just the lightening of hyperpigmentation, just seeing the skin so much brighter and smoother. So yeah, if you're ever interested in getting a chemical peel done by me, definitely give us a call to get scheduled and to have the full blog post to go in all about TCA. Please click the link below and it'll take you to our blog. Thank you guys for tuning in and have a good rest of your Wednesday. Bye.